In medical news, 200,000 American women are diagnosed with breast cancer every year, and many of them will need to have a mastectomy and then choose an implant or a prosthetic device. While saline implants are the most common, there are other options women should consider before making that big decision.
I was diagnosed with breast cancer last year, March 2006.
47-year-old Lynn Curry had a mastectomy and chemotherapy. The Parkland resident decided not to have an implant until she could consider all her options.
An implant, of course, was one option that was available, and then a very common surgery is the tram flap, reconstruction using abdominal tissue.
The tram flap would affect the use of Curry's abdominal muscles for the rest of her life. She felt saline implants were not an option because she wanted a more natural look.
In January, I went in and had the DF flap reconstruction done.
The DF flap stands for Deep Inferior Epigastric Perforator Flap. It is the latest in the evolution of breast reconstruction with autologous tissue.
Cleveland Clinic plastic surgeon Martin Newman says surgery is complicated, lasting up to 9 hours in Curry's case. However, the benefit is the patient's reconstructed breast is made from her own tissue.
It allows us to transplant tissue from a person's abdomen to their chest to recreate the breast.
Remove the abdominal tissue, skin and fat, from the abdomen and harvest an artery from within the abdominal wall.
The artery is used to supply blood to the new tissue. Good venous flow is critical to the success of the surgery. While saline breasts will likely need to be replaced over time, Curry's reconstructed breast will not.
For the short period of time that it impacted my life, it was well worth the end result.
DF flap is different from the tram flap procedure because the abdominal muscles are not used. Only the ab tissue is used in this one.